Good morning, everyone. Thanks for being on the call. I think we have almost everyone joined. So a couple of quick reminders before we get started. Today, we have on the call our cohort 2 in-person students, as well as our virtual only online students who are having their last day. The cohort 2 in-person students are finishing out their first week. So a couple of reminders to make sure your full name is shown in your Zoom profile so I can take attendance. And if you have questions, use the chat function or raise your hand and we will call on you. If you do use the chat function, please either chat the whole group or directly to me. Sometimes our speakers can't see the chat. So our first speaker is going to talk about the role of medical assistants and scribes in healthcare. So please welcome Hannah Willover.
Hi, everyone. My name is Hannah. I'm from Sacramento, but currently in Colorado. I got introduced to the medical assistant field just through research online. I knew I was really interested in physician assistant school, and one of the requirements is clinical experience or direct patient care experience. And so in my research, I was able to see a bunch of different roles as different options. And I was choosing between scribe and medical assistant just kind of stood out for me. So I did an online program through Career Step to get certified as a medical assistant. And then I got in-person training through a dermatology clinic. I loved being a medical assistant. I loved the direct patient care. You're the first face that patients see when they walk into the clinic. You're kind of there to answer any of their introductory questions, and you're kind of the middleman between them and the provider. So I loved kind of being a patient advocate if they didn't feel comfortable asking a question, but then also just kind of setting the tone of the visit as a medical assistant. I then in my job got on-site training to be a scribe. And I loved that because I was then allowed to be in the room in every visit with the provider. And I learned so much information so fast about dermatology. And I was there seeing the provider have those difficult or funny or easy or whatever kind of conversations were coming up. It was just amazing seeing those relationships build between the patient and the provider. And then you also just kind of got to know the providers on a more personal level. You got to see their work-life balance. You got to see how they work through some problems. And then you kind of just got more familiar with an online medical record and interacting with patients through a different avenue. So I applied to physician assistant school and I got in. I start Monday, so I can't really speak to how much that's going to look like, but I'm very excited. So just kind of a little overview of what a physician assistant role is. Is there a licensed clinician similar to like a nurse practitioner or a doctor? And most of the time they practice under most of the time they practice under a supervising doctor. And so that person provides a lot of on-site training for the physician assistant. Schooling ranges between 2 to 3 years. So my program is 3 years, and that's a mixture of in-class training and then also clinical rotations and being on-site in a clinic or in a hospital with patients. Physician assistants can work in any specialty, which is very cool. And one of the things that stood out to me about physician assistants is that let's say you start out in a specialty and then for some reason you're feeling a little bit burnt out, or your work-life balance is feeling off, or you want to start a family, or you have to move and you want a fresh start. You can change specialties, which is not something that's as easy for a doctor to do because they have to do a residency. So that stood out to me as a physician assistant, and getting to talk to some physician assistants where they started out in a more kind of chaotic schedule, and then they were able to switch over to more of an outpatient setting with more regular hours. So it's kind of what's up to you, but I liked that little bit more flexibility. No one ever knows that they're actually going to switch specialties. I may find one and love it, but just to know that I have that option has always stood out to me. So I didn't know if maybe there's anything else that you wanted me to cover or any questions that anyone had about the medical assistant, scribe, PA school.
Can you describe what a scribe is? Like, what do they do?
Yeah, so as a scribe, at least in dermatology, I was there to help the provider take accurate notes. So in a dermatology appointment, the provider is focused looking at the patient's skin, and it's hard to have a good connection when they see something, a mark, a mole, a skin tag, and then they have to turn and enter that into the computer. And with dermatology, it's very important to have the site, location, description, size, all of that accurate. So as a scribe, I had to be well versed in medical terminology, mostly specific to dermatology, because that's what I was in. But with any specialty, you'll want to kind of have a wide berth of medical terminology under your belt. But I was there to basically log everything that happened in the visit. And it's important as a scribe to do that accurately, because let's say the patient comes back a year later and they're asking about that same spot. You want to make sure left, right, those locations are correct. And also, medical records are legal documents. They're seen by other medical providers. They're sometimes seen in court. So I am there as a resource, as a scribe for the provider to take off some of that busy work of making sure a note, all the little fine tuning is done. And so I work with the provider afterwards to review the note, make sure everything looks correct, make sure prescriptions look okay, make sure orders look okay. But I'm there to basically write an office visit note, which I found so helpful in my medical training to understand as a provider what that may look like. And it also introduced me to an online medical record. I got to be pretty savvy with an online medical record. If a patient was wondering what had happened in a previous visit, I was able to do that and look through those previous visits while the provider was continuing the office visit. So as a scribe, you mainly work on a computer. I did know other scribes where they weren't in the room in a different specialty, and the doctor would record notes of what happened in an office visit afterwards, and then she would then transcribe after that everything that he went over in the recording. So it may be different depending on the setting, but you're really there to take notes and take accurate notes and to help the provider save on some of that busy work.
What kind of education did you get for medical assisting? Like, how did you get into that?
Yes. So I was looking in a bunch of different options as either in-person training or online training. When I started it, I was still in class, so my schedule was a little bit tighter. I was taking some prerequisite courses for PA school. So I ended up doing an online program called Career Step. And it's one where you can pace it as you go. Normally, they give you about, I think, 8 months to a year to complete the course, but they say some people complete it in 3 months. But you do online modules that you go through with videos and practices and exercise, and then you test at the end of every module. And then at the end of that, you have an externship. So I was able to get connected with the dermatology clinic I ended up working at, and then you get in-person training for all of the more tactical sides to what a medical assistant has to do, like taking blood pressure, giving vaccines or giving shots, and getting that hands-on experience. And then they had to sign off on my hours. And then once I had that done, I was able to submit that to my program. And then I got assigned a test, a final exam to become certified as a medical assistant. So once I got that completed and I passed, I then received my certificate online and then was able to do it that way. I also had friends who started as a medical assistant without training. So they just got hired by our clinic and they got all on-site training. And then I think it's after maybe 2,000 hours, there's a way that you can then have them certify your experience and you can then take the test as well. And then I think you still need to, for some externship stuff, get some hours logged, but that was another avenue that I was introduced to after I joined my practice. But I also had friends there who did online or in person and online ones where they were in the clinic with classmates. So there's definitely pros and cons to each. I didn't get any training until I was on the job, and it was all like with a patient, whereas my coworkers who did the more in-person classes were able to practice like giving vaccines on each other. So I felt comfortable and confident enough to do it with a patient who consented. But depending on what you feel comfortable with, the pace you want to go, there's definitely different options out there for medical assistant.
Was it paid on the job training?
I'm trying to think back. No, it was not. So at that time, I believe I was unemployed and on unemployment. So that helped it make it a little bit more affordable for me to be able to be in an externship that wasn't paying. But with the externship, I did it full time so that I could get my 100 required hours out faster. But if you wanted to still work another job and slowly build up on those externship hours, there are clinics that can be more flexible with their timing so that you can still afford to work and then also do the externship at the same time. And then I started out, it took me about 2 to 2.5 weeks to finish my externship hours. And then I got hired on full time. But there were those people that just got hired on and then got on-site training. They were limited in what they were able to do. They weren't able to give vaccines. They weren't able to give injections. They weren't able to drop medications. They were able to just do more of the basic tasks. But they were paid. And then later on down the road, they decided to go through the training to become certified.
Are there any questions for Hannah? Quiet today. What did you like about working in dermatology?
Oh, I see a hand. I can answer that question after a second.
Yeah. Sneha?
Oh yeah. Hi. So I was wondering what are the biggest challenges that you like face in your practice? And like
Yes, so I would say some of the biggest challenges I faced as a medical assistant were the balance of patient care and customer care. There's a lot of patients that come to you with complaints because they've been waiting a really long time, or they're in a gown and the room is cold, or they are just confused on what's going on. So sometimes there are challenging interactions with patients where you are taking kind of the brunt of their frustration, and you just kind of have to know it's not against you. And I'm sure everyone in their own healthcare experience has had those experiences where they've kind of been sitting there and the frustration grows, and you now have that kind of backside knowledge to be like, well, I know why it's running behind. It's because this person had an emergency and this happened. But to just offer that connection and empathy with the patient and seeing if there's anything that you can do. But it can be frustrating at times when you're running late and you've been running around and you go to check on a patient and they kind of snap, but you have to know that they're probably scared in their scenario. They don't know what's going to come out of their office visit. So learning how to kind of take a step back, take a deep breath, and remember you're there for them. It can be challenging at times, but very rewarding once they kind of recognize you're there for them. But yeah, the customer service side of making sure the patient is happy with their experience can be hard at times. And then the question about dermatology. I loved dermatology because those patients, some of them had been coming to our practice since they were teenagers, and now they're 70 years old. So it's very similar to primary care where you can build those long-term relationships with patients. It's regular hours, which is also very nice. But then they also do a lot of procedures, which I really liked. So if a person were to have a skin cancer, one of the options to treat it is to cut it out and do what's called an excision procedure. And as a medical assistant and a scribe, we get to assist in those procedures. And I loved it. I loved seeing the providers explain their technique, what they were doing, why they take this amount of margins, depending on the skin cancer, the different types of suture closures that they would use, how they calm down patients if they're a little bit nervous. I just liked that balance of the more clinical, regular patients and also getting to do the procedures. Sometimes there's urgent rashes that come in. It was cool to see in dermatology that sometimes rashes and other presentations on the skin can be because of underlying causes somewhere else in the body. And seeing how interconnected that could be with the skin, I had just never known that before. So that was really interesting. And then, yeah, just learning all the different medications and treatment options and seeing babies who have a little bit of eczema to teens who have some acne to older people who are suffering with some skin damage or hair loss. There was just so much that could be offered in such a wide berth of patients that I loved getting to see them. I loved getting to do the procedures. It was just a great experience.
How much does a medical assistant or scribe make generally, like an hour annually?
Yeah, so my practice was a private practice, so it's a little bit different. I started out at $19 an hour, and then once I got certified officially, and I'd been there for my like 90-day period, I got a 50-cent raise. And then normally with my practice, how they did it was every year they did a review and see if you could qualify for another raise. I do know there are other jobs like through Sutter, Kaiser, UC Davis that can pay more. I don't know what their starting salary looks like for someone who's like fresh out of medical assistant school, but I had a friend who worked with us and then went to UC Davis because she just needed more regular or she needed more she needed more pay, but then she also needed like different insurance and benefits because she had 2 kids. So she went to UC Davis and I think she was making about 25 to 27 an hour. But she also had about 5 to 6 years of experience under her belt. So I think it just kind of depends, but sometimes those larger corporations are able to offer a little bit more money, but there are perks to private practice. We had reps come in pretty much 4 to 5 days a week and we got Starbucks. And that was really nice to have that little benefit. And they were super flexible with hours, especially with students. And it just felt like they were there to kind of support you a little bit more, whereas a major corporation might have a harder time focusing in on an individual. Whereas if there's only 4 or 5 people in a practice, they're really there trying to build a family. So there's always pros and cons, but I enjoyed working in a private practice. It allowed me to save up. I lived at home with my parents. So yeah.
Do you need a college degree to be an MA, a scribe, or to get into PA school?
So by the time I did my MA training, I already had a college degree, but I do remember having some colleagues who did a program through their high school. So they were able to get certified through them. So I don't know that if they also had to get a college degree. I don't think so. But for PA school, you have to have a college degree and then you have to meet certain requirements. So they have prerequisite courses that they want you to take. So some people, similar to medical school, may major in psychology instead of biology or chemistry, or some people do business or history, but they have to make sure that they hit all those prerequisites to qualify for PA school. Also, they need shadowing hours with a PA or another type of provider. They need letters of rec for PA school, and then they need most colleges require at least 1,000 to 1,500 hours of direct patient care experience. And I believe it's the same for scribes, where with medical assistant, I think you can just get the training and certified. I don't think you need a degree, but I don't know for certain.
Are there any other questions? Quiet this morning. We have 53 of you on. Any other questions for Hannah? All right. Well, thank you for being on the call. I really appreciate you being here and giving us an overview of all the different roles you've had, and good luck in your PA journey.
Thank you.
Thank you for being on the call. Have a wonderful rest of your afternoon.
Thank you. Thanks for having me, guys. Nice to meet you all.
All right, guys. So we're going to take a little bit of a break while we wait for our next speaker. So be back here at 10:30. All right, welcome back. All right, so you learned a little bit about medical assisting and scribes and what they do. And Hannah touched a little bit on physician assistants. So up next, we're going to hear from a nurse practitioner, which is different from a physician assistant, but they all work together. And she'll talk a little bit about that. So please welcome Ivy Li-Garzona. Oh, you're on mute.
Okay. Can you hear me? Okay. Hello, my name is Ivy. This is my second year doing this. I'm a nurse practitioner in pediatrics. I actually never thought I would go into pediatrics or become a nurse practitioner, but here I am 13 years later working as an NP in pediatrics. I right off the bat, like after high school, thought I was going to go to medical school. I went to UC Davis. A little backstory behind me. I went to UC Davis for undergrad, and I majored in biochemistry, molecular biology. It was about two years into it where I realized I was not happy with what I was doing and going into pre-med. So I was talking to my pediatrician, who was a really close family friend, and she told me, like, hey, come work at my office for the summer and see if the medical field is for you. And so I did. I worked as her front desk over the summer, and I got to know she had an NP working with her. And so that's how I got introduced to what an NP was. And so I actually followed her, and I loved what she did. She was still able to see patients. She diagnosed, she was able to prescribe very independently on her own. And I thought, it was like, hey, this could be something else. And so that kind of made me look into other fields of work in the medical field. So instead of MD, I looked into PA versus NP. And so she talked to me. She was a really good mentor to me during that time because I was not happy with, I thought I was going to go to medical school, and I couldn't fathom, like, what am I supposed to do now? So when school started back up again, I actually changed my major. I did human development and then just minored in biochemistry just to finish it up. And then I did prerequisite classes for nursing, and then I looked into schools around the area, and I got into a nurse practitioning program up in Sacramento called Samuel Merritt. And so they had a program, a 3.5-year program, where you would get an RN license and then your NP license after that. So you would do 2 years after for your master's. And again, I was like, okay, I'm going to go into geriatrics. I actually wanted to work with the elderly population after that. And so I was going to be an NP in geriatrics. And so that was my goal at the end too. But then that didn't work out either. When I graduated, it was 2011, so there was a recession. There were no jobs, and so I actually reached out to my old preceptor in pediatrics, and she recommended me to her boss, the doctor, and he interviewed me and liked me and offered me a job. And so I thought what was going to be 1 year in pediatrics just to get my foot in the door turned out to be 13 years now in the same office, and I love it, and I love what I do. It's very flexible. I have a Monday to Friday job, 8 to 5. I come home every night, see my kids. So it's a very flexible career choice that I made. And I actually don't regret like anything that has happened. I think that's my backstory.
Can you talk about the difference between a PA and we have a question and then we'll get to that. Jess Mahar.
So, what's the difference between a doctor and an NP? Like, what are some differences?
Well, I practice under my nursing license. So I like medical doctors, they are under a medical board. So if there's any issues, their licensure is under the medical board. I'm actually under the nursing board. So I work under the California Board of Nursing. So two different fields and like powers that will give me my license and can take away my license. With a recent law that was passed, I actually, nurse practitioners can actually open up their own practice without a doctor. They can actually, me and another nurse practitioner, we are actually the main, one of the primary providers at our office that I'm at, because we're very independent. Like I've done it for 13 years where the doctor actually doesn't come in often to see patients at all. So it's mostly me and another nurse practitioner that will run the office. And so, yeah, we're very independent versus a PA where they have to work under a doctor and they have to be signed. Their charts and everything has to be signed by an overseeing physician. So, yeah.
Okay, thank you. That makes sense.
Yeah.
What other questions do you have about nurse practitioners and how it's different? So what do you do? So in pediatrics, how is that different? What do you do in pediatrics every day?
I see babies. Well, it's a range of ages, from newborn, so maybe like 2 to 3 days old, up until like the age of 21. So I do see adults technically as 18, 19, 20, 21-year-olds. But mostly it's just infancy, childhood, and adolescence are my primary population. And I do see them for wellness checks, of course, vaccinations, sick visits, like if they're not feeling well. And so they'll come in and I will check them, give them a checkup and see what's going on with them.
Do you do nurse practitioners also work in hospitals or just in private practice?
NPs can work in the hospital. So I actually don't have hospital privileges. We are part of Sutter, but only at our office, the doctors have privileges at the hospital. So especially with Sutter, they actually haven't given, there's a lot of legality with giving outpatient NPs privileges in hospitals, but NPs can work in the hospital, so they can get hired for a job within the hospital system. So yeah, there's a little gray line.
I have some questions in the chat, but first we'll go to Sophia.
So you mentioned that your shifts are like Monday through Friday 8 to 5. How like flexible is that? Is it always shift work with NPs, and like do you get to pick which hours and what days, or how does that like end up being sorted out?
That depends on where you work. So I work in an outpatient, like, the pediatric, your doctor's office. So they are only open Monday to Friday. I'm my employer is very flexible. So if I do want to work 4 days a week, I can. Versus nurse practitioners in the hospital setting, that's by shift. So they can actually work in the middle of the night, like think regular nursing or the doctors in the hospital. They can work. There's always a doctor in the middle of the night too, that's at the hospital. So same thing. There's going to be always an NP. It could be a night shift. It could be a day shift. It could be a weekend shift. So that's the difference between like the outpatient and the inpatient hospital setting.
Okay, thank you.
Question in the chat: how was majoring in biochemistry? What did you enjoy or not enjoy about it?
It was just too much chemistry. I just hated chemistry. I think like all the other stuff as part of the majors I could do, but it was just the actual chemistry part. Like it just wasn't clicking for me. Which I mean, like we know basic chemistry in my work, but like, yeah, I just did not understand the molecular part of it. It was just too much. It wasn't clicking with me. I was getting C's on tests, so I was like, if I don't understand this, maybe I shouldn't go to medical school, because that was a big part of everything. Because for medical school, it is a lot more chemistry involved, and other classes too. But I just did not like the chemistry part of it.
Okay, in the chat as well. So what's the difference between what you would do as an RN versus an NP?
So an RN, they follow orders from a doctor or an NP. So they have to follow orders. So they get told like, hey, give this med to this patient, do this. So they actually cannot diagnose, they cannot prescribe, they cannot organize a plan of action or plan of care for patients. And versus like MDs and NPs, where we're like, hey, I'm going to order this kid has an ear infection, order them amoxicillin, and then it would be the RNs giving the amoxicillin to the kid.
Jessica.
So are you like limited on like what type of medication that you can give?
No, I can give everything.
Oh, okay. Thank you.
Yeah, all types.
We have one more question in the chat, but guys, keep them coming. Somebody else wants to have you define what the difference between a PA and an NP is. I know that's confusing even for me, what the difference is, but can you define it one more time?
So NP, again, I am under the nursing board. That's my licensure. PAs, they actually go under the like the medical board. So they are total separate entities in their license. But PAs and NPs, their range, again, in the different settings too. In like hospitals, they probably have different criteria and jobs that they can do. But in outpatient, we actually have one PA working at one of our offices, and they actually we do the same. We'll see the patient, we'll still diagnose, we'll still see them for wellness checks. But I think for her charts have to be co-signed later on by the overseeing physician and checked, basically, to make sure things were done properly, versus NPs. Once we close our charts and send, we're done. Like our overseeing physician doesn't really need to check on our work and co-sign for us.
Another question, what did you have to study and what degree? She says to become a pediatric. I assume that means to become a nurse practitioner in pediatrics. So what did you have to study and what degree did you get?
So we have to do in order to become an NP, nurse practitioner, you actually have to have an RN license, a registered nursing license. So that is, you go through nursing school basically, and then that it could be 1.5 years, it could be 2 years, and then 2 more years on top of that to get your master's in nurse practitioning. So that's considered an advanced practicing nurse. What was the second part? I'm sorry.
What degree did you get, and how did you get into pediatrics to become a pediatric NP?
So, my license is a family nurse practitioner. So I actually can see kids and adults. There are pediatric NPs, so they only specialize in kids. So when they go to school and they learn, their field, it's only pediatrics. They actually don't learn anything about adult care, like, hypertension, cholesterol, or any geriatric type of medicine too. So there are different fields of nurse practitioning too. So I have other colleagues who work in cardiology. So they actually specialize basically just in the heart, and nephrology in only the kidney. So they probably would not know as much like in adult care. If a nurse practitioner in cardiology gets thrown into a clinic for adults, they probably wouldn't be familiar with a lot of their care.
Which age group do you enjoy working with most?
Probably the babies and under 5 and infants. Yeah.
What about them is the most enjoyable?
They're just so cute, and they say the funniest stuff. Versus like when I see teenagers, they're just like one syllable answer. Yeah, good, okay. But like, I'm talking to a 4-year-old, and they'll be like, and then this happened, and then this happened, and then this. It's just fun to talk with, and it just makes the day go by faster.
Any other questions for Ivy? I don't see any in my chat. Oh, Leslie?
My question is, like, let's say you didn't want to work in pediatrics, are you able to switch and like have a different job?
Yes, I can. Because I'm a family nurse practitioner, I can actually go into a lot of different fields too. So if I wanted to go into an adult care or geriatric care, I can. I can actually specialize in other, like if I wanted to go into a nephrology field or a kidney field, I would be able to go into that field, but I probably wouldn't. I would have to probably get training on it. Like if I worked in the hospital, they would have to train me more in nephrology or cardiology. But my license actually is very flexible, where I can actually work in different fields.
Can you say again how long the education is, like how long the journey is, how many years of each area nursing school and all that?
On average, I mean, like after, if you go to like a 4-year college and get a degree in something. So say like you have a bachelor's in, it could be English or it could be music, a bachelor's in anything. It could be about 3.5 years after that, because there are a lot of programs now, which is a post-bachelor program where if you have a bachelor's in a degree, then they can, and you fulfill all the nursing criteria. There's like nursing classes that you have to take usually to apply to nursing school. And once you fulfill that, then usually it's 1.5 years for the RN degree part, and then 2 more years on top of that for the master's in nurse practitioning portion. So after a undergrad degree, it'll be like 3.5 more years. Versus, I guess, with medical school, it would be after undergrad, you would be 8 years to become a doctor usually.
What is the hardest part of becoming an NP?
The schooling, of course, just getting getting your hours and like clinic hours and seeing patients and getting all that. There's a lot of hours. It's just like medical school where you have to fulfill all the criterias to pass a class. Basically, you have to fulfill, like, for this semester you have to have 400 hours in I don't know, primary care, and so you actually have to work in clinic, the same as in medical school too.
Do nurse practitioners make good money?
Yes, they do. And it depends on what field you go into. So I work primary care, and it can range from, I think the lowest now is, if you work full time, like it could be 140 a year, ranging to like 180, depending on, again, how many years you've worked. If you work in a specialty, you could, because you specialize in that one field, you can make a lot more. It could be like 180 in a year, easy. So, yeah.
How long would it be to become an NP if you get a BSN as your undergrad?
So a BSN, as in a bachelor's in science in nursing, then just 2 years. Because if you have a BSN, then you're qualified to, most likely you would have your RN license by then. And then it would just be basically the advanced practice portion, which would be 2 years. So say you go to nursing school, you get your BSN, then you only have 2 more years on top of that, which has come nowadays, and COVID, everything can be online now too. So schooling, I have a lot of friends that have become nurses. They worked in the hospital, they're RNs, but they just can't do the graveyard. They can't work overnights now. They have kids. They're like, and they want something more, basically. And they still want to do utilize their nursing license. So a lot of them have gone back to school for another 2 more years. And there's so many schools out there where it will be online, where she does classes online, but then she has to still do her clinical hours. So I think they have to find their own sites to precept in. So yeah, a lot of things can be done online now. Even a lot of like medical school classes I've seen have gone online. So yeah.
How much is NP school?
That varies too. You can go to a more publicly funded place, or I went to a private it was a private university. So but this was also 13, well, maybe 15 years ago. So I think mine was about, for the 3.5 years, it was about $100K for the entire time. Versus I think nowadays it's probably gone up, so maybe 120, 130 now. Versus medical school, which I've heard, like, in a private setting could be like 400K to finish medical school. So it really depends. I have a friend that's doing online NP school, so the 2-year program, and it's only 20,000 because everything's online, and she actually has to go out and find clinical hours herself. So she actually has to go find doctor's offices that she can go to, or inpatient offices, inpatient, like, hospital setting jobs to get her hours in. But she has to do that herself. So that could pose like a lot of hurdles too. So it could be very cheap to very expensive. It depends on where you go.
Let's see, is there any more questions in the chat? Did you work while going to NP school?
I actually did. When I was doing my RN portion for the first 1.5 years, I actually had I was a pharmacy technician too. So I worked at Walgreens part-time as a pharmacy technician until I got my RN license. And then when I got my RN license, I actually worked in travel medicine. So I did travel vaccinations for a travel agency for maybe a year and a half into my NP portion. And then I had to get it was getting stressful. I had to get my hours in. So the last like half year into the end of my NP school, I stopped working. It was just, it was not doable. The hours were too long.
How did you become a pharmacy technician?
That's a funny story too. I actually worked part-time in a pharmacy when I was 15 in a mom and pop pharmacy in Chinatown in San Francisco. And I worked there for probably into my undergrad too. And back then, if you worked a certain amount of hours or you actually completed pharmacy technician school, you could sit down for the test. So I actually didn't go to pharmacy tech school because I think I was 3 years into working that I learned on the job, uh, like different classes of medication, side effects, and everything that I just sat down for the test without going through any of the schooling, and I passed the test. And I was given a license, and so I was fortunate enough to actually be grandfathered into getting a tech license without having to go to, I don't, maybe it's a year program for tech schools, but yeah. That's totally a side story too. That's
Do we have any other questions? I don't see any more in the chat. If we have any additional questions, I can be in touch with you. So thank you, Ivy, for being on the call. We really appreciate it. That was a great overview of what you do. So have a wonderful rest of your afternoon.
yes,
So,
you guys do.
right. We're going to take a 5-minute break and be back here at 11. All right, guys, welcome back. All right, so you've learned a lot about doctors and nurses and nurse practitioners and physician assistants and medical assistants, but there is another side to healthcare, which is advocacy. So Lindsay Coate is the Vice President of Strategic Operations here at the Medical Society, and she's going to talk a little bit about advocacy. So welcome, Lindsay.
All right, thanks, Sam. I can't actually see any of you, but good to see you guys. I think I might be your last presentation for the virtual programming. How exciting. We're going to talk about something that's maybe not so exciting. So hopefully I'm going to make it interesting for all of you. We're going to talk a little bit about policy and legislative advocacy for healthcare. And again, I'm Lindsay Coate. I'm Vice President of Strategic Operations for the Sierra Sacramento Valley Medical Society. So we're going to talk a little bit about the who, what, when, where, and why of policy and legislative healthcare advocacy. We'll talk about the impact of personal experiences on advocacy. And finally, we're going to actually practice some of your advocacy skills. So, Sam, I'm actually going to stop sharing here for a second because I can't see the screen at all. Will you share my slides for me, and I'll just tell you when to promote. Make sure you share the volume because I do have that, that video clip that's in here. Sorry. I want to be able to actually see if there's any questions or anything. You know, you're probably going to hate me because I have a lot of clicks for the slideshow. You're welcome. So you get to actually, you know, a lot of paying attention with this one. Sorry about that. Sorry guys, give me just a second here. Okay, go ahead and go to the next slide. And one more. Okay, so hopefully you all know what the Medical Society actually is. Our mission is to promote the art and science of quality medical care and to enhance the physical and mental health of our entire community. We're actually what's known as a association, and we're the local physician association. So we represent 6,500 doctors and medical students in El Dorado, Sacramento, Placer, and Yolo counties. And what's really important here is we are a part of the California Medical Association, and that's the statewide association. Next slide, please. So we're what is known as organized medicine. And like I said, we're physicians and medical students, and we all try to come together to form policy on healthcare related issues. And we actually use that policy to influence local, state, and federal regulations. So like I said, the SSCMS, that's us, we're at the local level, and we talk to local level politicians. The California Medical Association is the state level, and they talk to state level politicians. And then finally, all physicians, if they'd like to join, there's the American Medical Association, and that is at the national level. So every industry normally has a trade or a professional association. So I know you've talked to a lot of different professionals over the last couple of weeks. So there's a physician assistant association, there's a nurses association, medical assistant association, dental association, optometry, physical therapy. Will you click, Sam? So all of our roles are to advocate for their patients and their profession. Next slide, please. So what is advocacy? That is supporting a cause by influencing public policy and laws, and often trying to really persuade decision makers. So there's two types of advocacy that we're going to talk about today, and that's policy advocacy and legislative advocacy, and each work a little bit differently. So healthcare policy advocacy involves meeting with healthcare organizations, joining coalitions, or working to promote change to healthcare issues like access to care or affording your healthcare. This type of advocacy will help to change policies for organizations. Can you click, please, Sam? Once policies for organizations like SSCMS are set, they will then affect legislative advocacy direction that we decide to take. So engaging in legislative advocacy means talking to your elected officials. Did anybody see the presidential debate last night? I didn't. I don't really like politics, but I work in politics, so it's not exactly fun. I don't necessarily like watching politics, but we do have to talk to our elected politicians. So like I said, legislative advocacy means talking to your elected officials, like the mayor or your state assembly member or your congressman. I believe yesterday we had a state assembly member visit the students that were in the in-person sessions. And we also had a member of the staff from one of our congressmen visit. So that's what we were doing yesterday. We were doing advocacy. So hopefully working with all of these elected officials will change laws and regulations. Next slide, please. Sam, you're gonna kill me with how many times I tell you to click, and I'm really sorry about that. So there's many different people that work to create change. We have activists, we have advocates, and finally we have lobbyists. So an activist is someone who works outside of the system to create social change. Go ahead and click, Sam. So Colin Kaepernick kneeling to protest police brutality is a really great example of an activist. He was calling attention to the issue to change societal thought. He was working outside of the system that we're all in, and he was hoping really to appeal to everyone. Go ahead and click. Advocates and lobbyists work inside the system to create change. Now, it's important to understand the difference between lobbyists and advocates. Go ahead and click. Lobbyists are employed by an organization and they influence legislation. So we don't have any paid lobbyists at, oh, you clicked too fast, Sam, look at you. We don't have any paid lobbyists yet at the Sierra Sacramento Valley Medical Society, but we do have several paid lobbyists at the California Medical Association, but they're not the only ones who advocate. So we also have advocates. That's like me and like Sam. We go in and provide real world examples to help elected officials understand complex healthcare issues. You as students are actually advocates too. You all can be advocating on issues that affect you all as youth or affect you in high school. So who is your favorite advocate? It doesn't need to be a healthcare person. Go ahead and click to the next slide, Sam. So go ahead and put it in the chat or raise your hand, your virtual hand if you want. I'd like to see who you think are your favorite advocates, or if you can name any. Now, I do expect you all to participate. I'll wait a second. So these are my 3 favorite advocates. So the first is obviously Lady Gaga. She's amazing. And she's a huge advocate for trans rights and mental health care organizations. She goes and talks to politicians about them. She raises money for those organizations. She's fantastic. Pharrell Williams is another really great example of an advocate. So he has an organization that he raises money for and actually runs a nonprofit for Black and brown businesses. And he works really hard talking to organizations that produce products about how to advertise to Black and brown people, because it's very different than what is normally advertised to. And then finally, we have AOC. Now, she is a politician, yes, but she is also an advocate. And that's how she got into her political role in the first place, because she is an advocate for refugees and immigrant children. So I'm not seeing anything in the chat here. And I know that I'm the last person. All right, somebody named, oh, that's a really great advocate. Absolutely. Thank you for participating. Anybody else? I'll wait. Okay, I won't wait. All right, so now that we know some examples, thank you, America Ferrer. Yes, so can you tell me what is she an advocate for exactly? I knew who the first one was. Anybody want to take themselves off mute?
Oh, sorry, I was trying to get off mute. So
Oh, that's okay.
she advocates a lot for like women's rights and gender equality, especially in entertainment. And she does like a lot more. Like she does stuff like immigration and like racial justice too. But I think like mostly I think she's most known for advocating for women's rights and the gender equality in entertainment.
Excellent. Thank you. All right. So Hannah or Jessica, you both named the same advocate. Tell me, why is that person an advocate?
So I think she was like really influential or inspiring because like she survived the Taliban, and then she like spoke her experiences of how she was like oppressed, and like and she advocates for like women's rights, and I think it's like a really inspiring story.
Absolutely. And she can be considered an activist for sure, because I know she was working outside the system, but she also is talking to, organizations and nonprofits and things like that. So definitely a great advocate. I think we have time for one more. I saw, Senna, can you tell me who is that and why are they an advocate?
Okay, so Coate Chavez, she was like the first person, like the first woman who went to like online. She was probably like a lot because she was like from a poor family, and like no one actually encouraged her. She was like by herself, and like she was able to like afford it by herself, and it was like pretty challenging for her.
Awesome. Okay. So I actually learned 3 new advocates today, or 2 new, because I do one of them. So that's awesome. Thank you for sharing. All right, Sam, go ahead and go to the next slide. Like I said, now that we know about advocates and who they are and kind of what they do, we can talk a little bit about the policies that they work to change. So a policy is where an organization stands on an issue. So for example, SSVMS, where Sam and I work, we have a policy that's written down that all the doctors that are in our association agree with, that says our policy is to promote childhood vaccines. So we use this policy to come up with plans, programs, projects, decisions, actions, budgets, because everything costs money, rules and regulations for our medical society. So to keep this example going, SSVMS promotes vaccines by educating our community. Many of you who are in the in-person program saw the iron lung at our museum. That's talking about vaccines, the polio vaccine. We create social media content promoting vaccine safety, tons of social media content on that. And finally, we hold educational sessions for physicians to discuss vaccines with their patients. And then finally, we use this organizational policy to frame our legislative advocacy efforts. So for example, keeping this vaccine example going, we were champions for the vaccine exemption bills in the state of California. So too many parents were listening to propaganda and misinformation about vaccines. So we at our medical society and the California Medical Association helped to create and pass the laws that limit medical exemptions to only those that are medically necessary. And you can't use exemptions just because you feel like it to not have a vaccine. So that's our organizational policy. Next slide, please, Sam. Okay, so let's go ahead and put this into action for an example. So what time is it? How many of you enjoy setting your clocks forward and backward 1 hour? Anyone? Do you like it? I don't. I don't. I hate this law more than anything. Like, it's the worst thing ever. Sam, is there a noise happening in the background, or am I cutting out? No? Okay. All right, go ahead and press click. So I absolutely hate this law. And the CMA, the California Medical Association, recently adopted a policy about the doctor's stance in California on the time change or spring forward or fall back. Go ahead and click. So the CMA does support permanent standard time, meaning the time it is right now, it's 11:16 a.m. It shouldn't be 11:16 a.m. It should be 10:16 a.m. because that is standard time. So why do doctors even care about this, and why is it their policy? Go ahead and click. So the American Academy of Sleep Medicine said that, you know what, standard time is better for our bodies, and it's better for public health because there's less accidents happening because people aren't tired. So like I said, they recently adopted that change. So anytime a law in the state assembly or state senate that comes up about this, which there actually is a current law that's being considered right now, the CMA lobbyists will go and so will member physicians to support the law that said standard time is what the clock should be set on, and we shouldn't spring forward and fall back anymore. Go ahead and click to the next slide. Okay, so why do we care about this, and what is legislative advocacy? So like I said earlier, this is where we meet and influence, more specifically, federal, state, and local politicians. And we do this to change laws, pass laws, impact regulations, and also really to give our profession a voice and give our interests a voice as well, because we're all experts in what we do. Go ahead and click to the next slide, Sam. All right, so these are your elected congressmen on the top. The state senators and assembly members are in the middle, and these represent all the areas that just we are in California. And then finally on the bottom are the county boards of supervisors, and that's just for Sacramento County. So I didn't include all the other counties that we represent, and some of you may be from other counties. Not listed as well are city mayors and council members and school board members, just to name a few. There's a lot of elected positions in our region. So I'd like again for you to answer in the chat, and I am looking, how many of these officials do you think are experts in healthcare in particular? Anyone? So they make decisions on laws and regulations that affect healthcare workers, including doctors, the nurses that you guys have talked to, physicians assistants, pharmacists, dentists, technicians, medical assistants, insurance companies. Anyone? Do you think any of them are healthcare experts? Ami Bera, very good. There's only one. Only one. Go ahead and click, Sam. Only one is a healthcare professional. The rest of these are career politicians. They're farmers. They're business owners. Some are lawyers. Some are nonprofit executives. Some are parents that are really caring about our school system. Some are educational professionals. They are experts only in their field, and yet they vote on laws that affect everyone's way of life. Go ahead and click again, Sam. Dr. Ami Bera, somebody said that, is the only medical professional. Now, he's a longtime physician, and he is a member of our medical society. We were very excited to help him get elected to make sure that there are more healthcare experts in the halls of Congress. But even then, we meet regularly with Dr. Bera to make sure he understands all the issues that are facing physicians and patients today. So they need to hear how certain bills will affect their constituents. And that's you and me. That's the people that vote for them. I know you can't vote yet, but you will be able to vote soon. And you live in their districts. They need to hear directly from experts, or for the people that vote for them, or from the youth like yourselves. Even though you can't vote yet, they still need to hear from you. Because I guarantee you, all of these people that you see on the screen are hearing from many people who have no idea what they're talking about and are not experts in the field for the laws that they're voting on. Go ahead and click to the next slide, Sam. All right, so putting this into action again, here's another example. And this is advocacy against the use of tobacco. So we at the CMA and SFCMS have a policy that says we want to improve public health by supporting the reduction of use of tobacco products. So we advocate for change in other organizations. So we talk to hospitals and workplaces and school zones to make sure those are smoke-free environments. And then we also worked really hard to increase funding for smoking cessation programs and for educating about not smoking. At the legislative level, we advocate for changes too. So we advocated for the ban on the sale of flavored tobacco. There's many restrictions now, thanks to the work that all of us professionals have done to make sure that advertising and marketing to children is limited. And then finally, this is kind of a big thing. We advocated, and this was, I think I started at SSCMS at that time, so it was about 8 years ago, maybe 10. We were big proponents for Proposition 56, and that was a statewide ballot initiative that would raise the taxes on cigarettes by $2 a pack. And it did pass. And all the money that we raised, that extra $2 a pack, equals about $2 billion. And we pump that money back into the healthcare system to help us fund Medi-Cal, which is the insurance program for at least a third of the people in California. So that's how we advocate at the organizational level and policy level, and then at the legislative level. Next slide, Sam. So you can advocate. I know you can't vote yet, but you can still advocate. You can talk to your local politicians. You can write and email them and call them. You can attend town hall meetings with lawmakers. You can actually, and you saw this in action, like I said yesterday, you can invite legislators to tour or shadow at your school if there's something really important that you want to show them. You can campaign and maybe even donate. Maybe don't do that yet. You need to be 18. And you can also develop relationships with your legislators' local staff. And those are the two people that some of you saw yesterday in the in-person session. All right, so I don't think I have time, Sam, for the next slide. Go ahead and go to the next slide, but we're not going to play the video. So when you're meeting with a politician, there are some do's and some don'ts. And I was going to make you watch a 7-minute video, but I don't think we have time for that. So what you do when you talk to a politician is you tell your story. You tell it well, just straight from the heart. You try to keep it nonpartisan. So if you're meeting with a Republican assembly member, you don't tell them that you hate Republicans or that you hate Republican laws, and vice versa with the Democrats. You don't do that. You just keep it to your story and you stay on topic and you try to personalize your issue. You try to tell them why you care about it. Bring a story with you. Talk about, how this will affect you personally as a student. And of course, you have to say thank you. And I know I shouldn't have to say that, but you do have to say thank you. Even sending thank you notes to people that you're talking to will really go a long way. Handwritten thank you notes, they matter. Right, Sam? Right, I know, I can see, right. All right, go ahead and click again. So don't try to cover too many topics or issues. Don't argue, even when you disagree with them. I personally find that really hard to not argue with people that I disagree with, but you cannot argue with them. All you can do is try to get your point across. And again, don't forget to follow up and say thank you. Go ahead and skip to the next slide, Sam. Skip the video. It'll start playing. All right, so let's put this into practice. And there's going to be a lot of clicks here again, Sam. Sorry about that. So put in the chat or use an emoji or raise your hand. Who here has bad eyesight? Dr. Williams, go ahead and raise your hand because I see that you are wearing glasses. You have bad eyesight. All right, lots of bad eyesight people. Okay, so some of you didn't raise your hand and that's okay, but about 10 to 20 years, most of you are going to be saying, me, I have terrible eyesight. So there are several types of professionals who can treat our eyes, right? And we're going to discuss some laws for optometrists versus ophthalmologists. And we're going to work through policies, methods, and strategies for what we call scope of practice issues. And that means that unless you have the proper training, you cannot treat a patient. That's your scope of practice. You have to have the proper training. So an optometrist, go ahead and click Sam, is let's see, I lost my place here. An optometrist, they're not a medical doctor. Go ahead and click again, Sam. I told you to click again. But they're often referred to as a doctor. An optometrist did not go to medical school. They receive a doctorate of optometry degree after completing 2 to 4 years of college level education, followed by 4 years of optometry school. They perform eye exams and vision tests, and they're incredibly important. They can also detect some abnormalities of the eye. Click, Sam. An ophthalmologist includes a 4-year degree in college, followed by another 4 years of medical school, and at least an additional 4 years of medical and surgical training. That's called their residency. So after completing this lengthy education, a total of 12 to 14 years, ophthalmologists are then licensed to practice medicine and surgery. Ophthalmologists are the only eye care providers with the appropriate levels of medical education and clinical training to safely perform delicate eye surgery. So let's pretend, go ahead and click Sam. Congratulations, you're now all medical students and you are members of our medical society. And there you see a medical student practicing surgical techniques right there. So there is actually a bill, and this comes up every year, that our legislators are currently voting on. And it's called AB 1570, and it's by Assembly Member Lowe, and he's in Southern California. Now, this bill would make it legal in California for optometrists, remember the people that don't have medical training, to perform LASIK eye surgery on a patient's eyes, even though only the ophthalmologist is trained. So go ahead and click Sam. What do you tell a legislator? Does anyone want to take a crack at it? Remember, you're a medical student. Go ahead and click again. Dr. Williams, you get the ball rolling. You used to be, you advocate all the time on behalf of your physicians and for patients. If you were a medical student and you were talking about this bill, what would you say to me? I'm going to be Assemblywoman Aguiar-Curry right now. What would you say to me to convince me that this bill is bad?
Would the optometrist be able to anticipate the complications of the procedure and manage it?
Very good. Very good. And the answer is probably no. Right? So go ahead and click, Sam. So here's something that I would say if I were a medical student, which you are all medical students now, don't forget that. So as a medical student, I take an oath, and that's first to do no harm. And patient safety is the core to any medical decision. So why do you say that? Why would a medical student say that? Go ahead and click again. So another thing that you could say is optometrists are an important part of the healthcare delivery system. However, only ophthalmologists are they're the only professionals that are trained to perform eye surgery. Go ahead and click one more time, Sam. So I think this is the most important thing that you would say in this is, you know, assembly person or senator, which professional would you want to operate on your eyes? Would it be somebody that's trained or an optometrist? Optometrists are very important, but they're not trained. All right, go ahead and click to the last slide, Sam. So hopefully you guys have an overview of advocacy and what that looks like when you're talking about policies and what you're talking about when we're talking about legislative advocacy. I know this isn't the most exciting topic, but in order for you all, when you go into the healthcare profession, when you become professionals, when you become a doctor, a dentist, an optometrist, even a nurse, you need somebody like us in the background helping to make sure that your profession is protected. And I just want to remind you that you all need to fight for your professions when you decide to, whatever you're going to become, you need to fight for it. All right, are there any questions for me? All right, Sam, I ended on time. Yay.
Well, thank you so much. Thanks for that great overview. And if anybody has any additional questions for Lindsay, she put her email up there, but I will also share that in my follow-up email. So thank you very much and have a wonderful rest of your afternoon.
Bye, guys.
Okay, so this concludes for our in-person students. So if you are in the in-person program, you are free to sign off and I will be in touch with you next week with your schedules. If you are in the virtual only program, we have one more half-hour session with Dr. Williams to talk a little bit about what you've learned over the last 3 weeks. So I'll let all of the in-person students log off, and if you're virtual only, please stay on.
Which people are in the in-person?
So if you're shadowing at UC Davis or Kaiser and you were here in person this week, you can sign off. If you have only been attending online, then you need to stay on the call.
Okay, thank you.
Okay. So you met Dr. Eric Williams on day 1, 3 weeks ago, and he's back to talk to you a little bit about what you learned and reflect on the last 3 weeks. So take it away, Dr. Williams.
Okay, I hope all of you can see me. It's been a pleasure having you during the last several weeks. I hope that you did get a tremendous amount from participating in this program. One of the first things we spoke about was a brief description of the interaction between a patient and a physician at their first meeting. I've sent some material out and they will be emailed to you. It's a worksheet based on that initial discussion which we had. I wanted to again emphasize how important it was that someone was coming to you as a physician and placing themselves or their family member in your care. Having said that, we're trying to get a sense from you as to what your thoughts were about the program. Sam, am I echoing?
No, you're okay on my end.
Okay, awesome.
So does anyone want to share their experience?
Thoughts?
Yeah, what you learned.
In the chat.
we also had a hand raised if you're okay with me taking somebody off mute.
Yes.
Jeff Mahar?
Okay, so I think that this program helped me a lot to get an overview of the different fields in medicine. And I feel like it kind of helped me to know what I want to do. Like, for example, when they were talking about pediatricians, that was interesting to me. So I feel like any time that I was interested in any field, I would write stuff down that they said. So when it comes time to me going to medical school or during around that time, I can at least think back to what we learned here and the experiences and what the overview of each different field was. So I think it was really helpful because it's really hard to get exposure to the different types of fields. And I think that in these 3 weeks, we really got exposure to a lot of different fields. And it really helped to know like, oh, this field is the differences and similarities between each field. So it kind of helps you to like narrow down your choices. Because I'm interested in the medical field. So at least it helps me, okay, I want to be this doctor or I want to go into this field. So it really helped me to kind of narrow it down.
Excellent, excellent. One of the things I would encourage you to do is recognize that physicians speak to each other and what they do is related. So you've got to know what the orthopedics did, what the general surgeon did, what the primary care physician does, that we work together to help take care of that patient.
Sakita has
Are
her
there,
hand raised. Yeah.
are there any other comments?
Sakita?
Jessica?
We'll go to Sakita first. She had her hand up.
Okay.
So I think it's helpful, really helpful because we got to know like in the medical field, like I'm pretty interested in the medical field and I'm like I want to become a doctor, but we got to know like what their day-to-day life is and understand like what we want to do because we learned about different like aspects of it and what the difference is and like there's we come to a conclusion that we have so many options in medicine. So like I got to know like, okay, like a nurse practitioner does this, a doctor, a trauma surgeon does this, and we got to hear from a neurologist, and then like what it does, an ER doctor does this, and then like what does this and what who does this and like what kind of impact they're making and understand that okay, like this is what we want to do or this is what what seems interesting. So it was very helpful to me.
Excellent. Now,
Yeah.
sorry, there was another question.
Yeah, Jessica's next.
So like this like medical health like program like helped me like learn about like the different careers and like personally I know I wanted to be in the medical field, but I didn't know really what I wanted to do. And like learning like that there's like so many options like gave me like really important information and that like for example like there's like an infectious disease specialist who like went to military and like there's different options on how like you could pay for college and like how like they went like to their career in the first place and like it shows me like a realistic view on like what medicine is.
Okay, awesome. Thank you for that comment. Was there anything you feel that we should have covered that you didn't get or not enough of?
You can raise your hand or put it in the chat. We try our best to get as many speakers as possible, but I know we're limited on time. Anyone? Is there anything that we didn't cover that you really would like to have seen? Sneha.
Yes, so I really appreciate like how you was feeling a lot of pain, but you usually don't have a chance to like learn in reality. But I sort of like appreciate more because I want to be a cardiologist, so like you just cardiologist like a medical student. So I wanted to learn about it. So I feel appreciated.
Oh, did you say cardiology?
Yeah.
Yeah, that's a good specialty. I'll add that to my list. Anyone
Okay,
else?
very good.
I don't see
How
any
about
hands.
pathology?
Oh, oncology. Yeah, I have somebody said oncology as well.
Okay, and pathology? Now, were we able to put anyone with an endocrinologist? And I say that because the number of people with diabetes and other medical conditions related is rapidly expanding.
We did not have an endocrinologist. That's another good one.
Okay. Any of you with family members who have diabetes or heart disease or kidney failure? You can show your hands.
Mm-hmm.
Yeah.
We have several hands up. Yep.
Okay. So it's an important field. If there was anything else you could see in person, what would you have to have had the opportunity to be present with, such as demonstrations?
These students have been online for the last 3 weeks, so they haven't had an opportunity to be in
That's
person.
correct. Yeah.
So if there's something that you would like to see or like to do, Jessica?
So maybe like in emergency situations, like how to like provide first aid, like maybe like burns or like CPR, like emergency like aid, basically.
Okay. We will make an effort to try to get even students who are online CPR experience going forward. So thank you. If someone is in need of help, any one of you may be present, and it's of benefit that someone be present, even in your own home.
All right.
Sam,
Yeah.
guys, thank you very much for the time you spent with us and the effort you made. I wish all of you the best. And if you did make contacts, stay in touch with the individuals you were able to reach.
Yeah, I have a couple of words before we let you go. So I wanted to thank each and every one of you for joining the program, for logging on every day and being present. I'll be sending out a survey as well early next week where you can share, if you have a chance to think a little bit more about it, where you can share and answer some questions about the program. And we want you to stay in touch. For those of you who complete the survey, I will send you a $5 Starbucks gift card as well. It will ask you to provide your personal email address, and we'd like you to stay in touch with us. I'll also be sending certificates of completion next week to all those attended. Even if you missed a few sessions, I wasn't able to get the recordings up. Even if you missed a few, you will get the certificate of completion. So you all have my email address. We want to hear from you if you have additional questions, or down the road on your journey, you have questions or want to connect with someone, please reach out to me. And does anyone have any other questions? Jasmahar?
Will the certificates just be sent to our email then?
Yes, I will send
With our names on it?
Yes, I will send a
Okay.
certificate of completion with your name on it to your email address that I have on file.
Okay, thank you.
All right. Well, thank you all so much. Have a wonderful rest of your summer, and I hope to hear from you in the future. Bye, guys.
Have a safe and enjoyable 4th.
Thank you so much.
Thank you.
Take care.
I appreciate your time and effort.
Thank you.